Alright, so next up we have the glycogen storage diseases. And it's important to know the pathways of glycogen synthesis as well as degradation so that you can appreciate the disorders of glycogen metabolism. So what exactly happens when you have a deficiency or a defect in one of these enzymes? Well, the result here is a glycogen storage disease, which are caused by abnormal glycogen metabolism and allow glycogen to accumulate to toxic levels within cells. Here we'll review the 4 most commonly tested glycogen storage diseases, and all of these are autosomal recessive. Also, in all of these diseases, you can use the periodic acid shift stain, or PAS stain, to identify glycogen within the cells. Now expect to see at least 1 or 2 questions regarding glycogen storage diseases on your USMLE, so this is a very high yield section. Alright, now first up we have type 1 glycogen storage disease, also known as von Gerke disease, and it's caused by a deficiency in the enzyme glucose 6-phosphatase, as you can see here. Now remember, glucose 6-phosphatase converts glucose 6-phosphate into glucose so that it can leave the cell and travel to other parts of the body. So with a deficiency in glucose 6-phosphatase, you would actually see buildup of glucose 6-phosphate. This glucose 6-phosphate is then converted to glucose 1-phosphate and then converted into glycogen. Now muscles, they don't need this enzyme, since they are greedy and they use up all the glucose produced from breaking down their own glycogen stores. It may be helpful to think that von Gerke's disease affects mainly the liver and, to a lesser extent, the kidneys. Now thinking back to glycogen formation, if we have a buildup of glucose 6-phosphate, what do you think happens? Since glucose 6-phosphate activates glycogen synthesis, if glucose 6-phosphate is allowed to accumulate, then even more glycogen is formed. Now, as you might have guessed, patients with von Gerke's disease also have impaired gluconeogenesis, or the generation of glucose from non-carbohydrate carbon sources, as well as glycogenolysis, or the breakdown of glycogen. Consequently, patients with von Gerke's disease have increased glycogen stores within the liver, as well as severe fasting hypoglycemia. Now also, since glucose can't be dephosphorylated and leave the liver, this results in anaerobic metabolism, and this results in an increased blood lactate level. Also in this disease, you can see elevated uric acid levels, which can lead to gout, as well as elevated triglyceride levels. You can also see renomegaly, or big kidneys, as well as hepatomegaly, or big liver, and you can see an example of this here. Some other effects include renal failure, delayed puberty, as well as hepatic adenomas. And do you notice another weird thing about this liver? There you go, there's a hepatic adenoma present, and you can see it here. Now this is an example of a 12-year-old child with von Gerke's disease who has hepatomegaly as well as a hepatic adenoma. And it just goes to show you the severity of this disease as well as its early age of presentation. Now von Gerke's disease is treated with frequent doses of glucose to ward off hypoglycemia, since the liver is unable to compensate for the low blood sugar. Also, these patients should avoid fructose as well as galactose. Now next up, we have type 2 glycogen storage disease, or Pompe disease. And this is caused by a deficiency in lysosomal alpha-1,4 glucosidase with alpha-1,6 glucosidase activity, which is also known as acid maltase. Now this enzyme breaks down glycogen into glucose within lysosomes, and it's associated with some fairly serious symptoms that affect primarily the liver, the heart, as well as skeletal muscle. Now what you'll want to remember is that Pompe's disease trashes the pump, meaning that this disease affects mostly the heart, but there are other organs involved as well, those of which we just mentioned, the liver as well as skeletal muscle. Now the main finding within Pompe disease is a cardiomyopathy, as well as other systemic findings, such as exercise intolerance, as well as significant muscle loss. And once again, if you just think back to the mnemonic, Pompe's disease trashes the pump, you'll remember that Pompe's disease is associated with a cardiomyopathy. Now what about that muscle loss? Here you can see an image of generalized muscle loss of the quadriceps as well as ptosis and scapular winging due to muscle loss and weakness. Now once again, if you see a glycogen storage disease that focuses on the heart being affected, you need to have Pompe disease within your differential. Now the third type of glycogen storage disease is also known as Cori disease, and it is caused by a deficiency of debranching enzyme. Now do you remember the exact function of debranching enzyme? There you go. Debranching enzyme is required to break down glycogen into glucose by cleaving the alpha-1,6 bonds seen at branch points. Now this leads to the accumulation of limit dextran within the cytosol. And here it primarily affects the liver as well as muscles, and has findings similar to type 1 glycogen storage disease, or von Gurke disease, but without the lactic acidosis. A few other symptoms here include hepatomegaly, hypoglycemia, as well as delayed growth. The hypoglycemia here is milder in Cori disease than in von Gurke disease, and the symptoms in general are much more benign. This is predominantly because Cori disease does not affect gluconeogenesis, which is impaired in von Gurke disease because glucose remains trapped in the liver as glucose 6-phosphate. Now lastly, we have type 5 glycogen storage disease, or McArdle disease, and this is caused by a deficiency in skeletal muscle glycogen phosphorylase, also termed myophosphorylase. Consequently, this disease really only affects skeletal muscle and not cardiac muscle. Here, you'll see increased glycogen within the muscle, as well as the inability to break this down. So how may patients with McArdle disease present? There you go. Since muscles cannot get enough glucose from breaking down their own glycogen, this leads to muscle cramps, myoglobinuria, muscle weakness, as well as arrhythmias and electrolyte abnormalities. Now, would you expect to see hypoglycemia in McArdle's disease? Well, actually the answer here is no, since McArdle's disease does not affect the liver, which breaks down glycogen stores into glucose for the rest of the body to use. So with that, blood glucose levels are usually unaffected in McArdle's disease. Now patients with this disease also describe what's called a second wind phenomenon, which is an improvement in exercise capacity due to increased muscular blood flow. And if you were to get a few lab tests in patients with McArdle's disease during exercise, you would see a flattened venous lactate curve with a normal rise in the ammonia level. Well, alright, that'll wrap up the glycogen storage diseases. See you in the next video.